I started off my career as a nurse and as a summer student worked in long-term care. And before I went into medicine, and that's where my passion comes around long-term care. Currently, I'd like to, I'm delighted Osteoporosis Canada is here. I've worked very strongly with Osteoporosis Canada for a number of years. I've served as their chair of their board and also the Scientific Advisory Council as their chair. And here at St. Peter's, the Jairus Research Center is very interested in preventing these painful fractures from happening. One of my colleagues, Dr. Richard Crilly at Western, has said, how old do you have to be before a fracture doesn't hurt? And I think that as part of the Ministry of Health has funded the Ontario Osteoporosis Long-Term Care Strategy to reduce those painful fractures, prevent transfer and ending your life in an acute care hospital after breaking a hip. That really is our goal, that we don't want people to die from a hip fracture. We want them to be in their home to keep comfortable and pain-free. Long-term care is their home. Acute care in the hospital often is challenged with frail older adults, especially those with memory problems or dementia. And so I noticed people mentioning that their parent may have dementia and osteoporosis. Those two go often very hand in hand. Some of our research in Ontario recently has shown that the first 3 months of being admitted to long-term care is the highest risk time to break your hip. In order to solve this problem, we need to target the osteoporosis treatment, and we also need to target reducing falls. We've just, with the Canadian Institute of Health Research and the Ontario Osteoporosis Strategy, as well as the Ontario College of Family Physicians and the Ontario Long-Term Care Family Physicians, led an initiative to make recommendations to long-term care to try and address this issue. Because we know that with current research, we can reduce painful fractures from happening by 40 to 60%, which is pretty big. We could reduce the number of people from long-term care that show up in the last 3 months of their lives in the hospital, where they die often, very uncomfortable. So that really is the goal. And we know people with dementia deal better with their dementia if they're able to walk around rather than be in a wheelchair with a broken hip. So what can long-term care homes do? And what can families do? First of all, number one, my interest is that this is, osteoporosis and fractures are 40% is genetic. So I had a grandmother who had severe osteoporosis. She didn't break her hip, but she was very curved. So she walked like this. And a lot of people think that's normal aging. It's often related to fractures in your back from osteoporosis. And individuals in long-term care who have broken bones in their back will sometimes get agitated and given the wrong type of medications to control the agitation because they're in pain. The other more common fracture as well is that people fall and break their hip. But the spine fractures are actually the most common. About 40% of people, those older women in long-term care, have a number of spine fractures. They're quite painful and often missed, and antipsychotics are used instead. So tip number one is when your loved one is being admitted to long-term care, is asking, have they had a fracture in the past 10 to 15 years? because those individuals need to be on treatment to prevent the next fracture from happening. We know it's going to happen. Vitamin D and calcium in the high-risk individuals who have had a fracture can reduce the risk of falls and fractures. So that information is between 800 to 2,000 of vitamin D. And seniors that are often in long-term care have very low vitamin D levels, and their muscles can become painful or uncomfortable. And vitamin D is about $20 a year. It's a very cheap option with very few side effects. So we are recommending that long-term care homes establish these practices. And I think families who are more informed and residents who are more informed can advocate for the best care. Now, folks will often say to me, especially physicians, our residents are on so many drugs, you're asking me to start more drugs. And I'll often say, when I look at the medication, that they're drugs that we can stop, that there are things that can be discontinued and reviewed. Because that's my area of expertise, is working with older individuals. The other things that we know, as we've talked about, there are a number of medications by mouth, through a needle twice a year, or once a year through an intravenous. So if taking a pill is a challenge, there are other options. The drugs you need work very quickly within a year to reduce your chances of breaking something. Now, and those options are covered by the government for seniors. So having that discussion with the nurse, with the pharmacist, can often bring the physician on board, because it's a team in long-term care. And so engage your healthcare team if you can't directly access your physician to advocate for your parent or for yourself. We know from the hospital we could do a better job of starting treatment on patients. We often send them home, and we could do better initiating treatment after a fracture. In terms of falls, I know people were talking about physiotherapy. We know people who are high risk, just walking actually may increase the risk of breaking something. So people who are high risk, when I say high risk, who have broken a bone before, the physiotherapist needs to focus on balance and resistance training. And even though you may be very frail, or your parent be very frail, nutrition and that targeted exercise of balance and resistance training is really important. The other things that reduce falls is reviewing the medication somebody's on. We know that certain drugs for depression that control behavior with dementia can also increase your risk of breaking something. And as dementia changes over the time you have the disease, you may not need that dose of medication, or you may not need that medication anymore. So individuals change as the disease changes. So you may have, your parent, or you may have come into long-term care with certain drugs, that can change. The bottom line we want to share is that we can reduce the chance of breaking something, prevent the pain, and improve the quality of life for residents in long-term care in Ontario.